Hi, everybody. Today I will be talking about my word cloud. I've asked 20 people to express what comes to mind when they think of the word public health. Before I started gathering data for the word cloud, I expected a lot of one worded answers and a decent amount of in common responses, like disease prevention, COVID, healthcare, and government involvement. Most of the people I interviewed were my friends who were all freshmen in college. None of them have taken public health, so I thought it would be interesting to get their raw thoughts on what public health means to them. I expected that their responses would be shaped by their general knowledge of health topics, but also influenced by their personal experiences of what they've been exposed to growing up, whether that's through media, family discussions, or even just basic health education in school. I also interviewed some family members, like my cousins and my brother, who are a bit older than me and have graduated from college already. All of them majored in health sciences, so they have a bit more of a deeper understanding of what public health is. I wanted to see how their responses would be different from my friends' responses, given their academic background and more involvement in a health related field. I expected their answers to be more informed and even more detailed. So surprisingly, no one mentioned COVID when they thought of the word public health, but given how important the pandemic has been to the global health discussions over the past few years, I honestly expected it to come up at least once. So I was surprised by a certain group of my friends' responses. I didn't expect them to know so much about public health, especially regarding government health related topics. However, I didn't find it as compelling as what my cousins had to say because I already knew they had a good understanding on what public health means. I found that a certain group of my friends' responses leaned more towards government-related aspects of healthcare, such as high costs, profit-driven systems, and public sanitation. They focused more on the financial side of healthcare and government, whereas others talked more about environmental hazards, mental health, urgent care, and hospitals.